My name is Susan D'Antoni. I'm the Executive Director of Montgomery County Medical Society. Thank you for joining us today for another of our webinars in the Rapid Response Series, which we began at the significant onset of COVID in our community. We have muted participants at the beginning of this call for sound quality purposes. This call is being recorded and will be available on our website later today for your future reference or for you to share with your colleagues. We'd like to recognize our sponsor for this webinar, Dr. Choice Medical Services, which is a Physician Connect partner with Montgomery County Medical Society. Samantha Akhtarzandi, who is CEO of Dr. Choice Medical Services, has joined us today and will provide a brief update. Samantha?
Yes, welcome. So I know that many of you are still in the process of trying to implement telehealth policies in your offices, and some of you are struggling with the billing aspects of that. We've seen many of the payers change their rules weekly, and that has been a challenge in terms of what place of services and what modifiers to use. And we've also seen conflicting ways in which the payers are processing claims. Some of denials are happening that shouldn't be. For example, Aetna with preventive well visits this week has started rejecting them. So I'm here if any of you are having any issues related to billing, more than welcome to help you with answer any questions or assist you with problems that you're encountering. Thank you.
So we thank you for your support. We have included a resource page that Doctor's Choice Medical Services sent to us, which does provide a lot of coding instruction for each one of the payers. So that information was both in our e-news as well as on our website. So we would encourage you to visit that. So first, a few reminders before we begin. As I was just noting, please visit Montgomery County Medical Society's website, montgomerymedicine.org, and MedChi's website, medchi.org, to access the many resources which are constantly updated there. Since COVID began, I understand that we've actually updated our website 140 times. And so we are very committed to making sure that you have the best and most up-to-date information. We also encourage your participation in the Dr. Haft calls, which have been very helpful to keep being informed about COVID in Maryland. The link to participate in these calls can be found in the email that you receive from MedChi. The calls are Monday and Wednesday at 5 p.m. and on Friday at noon, and pre-registration is required. Those links are also on our website. Soon, we will initiate local calls with our County Health Officer, Dr. Travis Gales. Since the local COVID-19 situation continues to change, we thought this would be helpful as there are many local concerns or challenges for you to consider in concert with those which have been issued by the state. We are setting those calls up now, so watch your email for an update. Also, we understand that acquiring enough PPE to open is a challenge. While you may have adequate PPE for the first couple of weeks, you may not know when you can acquire more. MCMS will be rolling out a new opportunity for our medical practices to help you acquire PPE. Handcraft Linen can provide recyclable gowns for your practice for a fraction of the cost of paper. These gowns do provide and meet all of the CDC requirements. Please watch your email and e-news for this information. Also, we encourage you to complete the PPE form with the County Health Department. Carissa will make sure that this link is in the chat box, and again, it's also on our website. So let's move on to today's discussion. I know many of you are looking forward to reopening or ramping up your practice to see non-urgent and routine visits. This webinar, entitled Practice Reopening, Readiness, and Preparedness, will help you address many of the important issues which should be considered prior to opening. This webinar should not be construed to suggest the Medical Society is condoning opening at this time. Based on the guidance from the governor and local health officials, you must use your own judgment as to whether your practice can meet the standards outlined in the governor's order, and that you're willing to attest to the Maryland Department of Health and to your patients that you have addressed all the relevant issues so that you protect the health of your patients, your staff, and yourselves. You must weigh the local considerations in your area and also be prepared, excuse me, just a moment, and also look at your own practice environment. Today, we welcome two experts in the field of practice and regulatory law and operations. This webinar will not address all the clinical aspects of reopening. Reza Ghafoorian, Esquire, is also a physician. Dr. Ghafoorian is the founder and principal attorney with G2Z Law Group, a Physician Connect partner with Montgomery County Medical Society. We also welcome Maureen McCarthy, who is a CPA and principal and managing director with KatzAbosch, a full-service accounting and consulting firm serving medical practices throughout the region. Dr. Ghafoorian will address practice and regulatory law associated with reopening. Ms. McCarthy will address the operational issues associated with practice reopening or ramping up. We will take questions after both of their presentations. We encourage you to use the chat function to submit your questions. Once we have addressed advanced questions and those submitted by chat, we will open to questions via the phone. To ask a question, you can hit *6 to unmute yourself, ask your question, and then hit *6 again to remute yourself. So Dr. Ghafoorian and Maureen, we welcome you today. And Dr. Ghafoorian, we'll start with you. Thank you so much for joining us and sharing your expertise.
Thank you, Susan, and thank you for the introduction. We have, let me first share the screen with you. And we'll start. So we have, I have my colleague Jay Williams with me, and I'm sorry, Susan, I didn't send you his information. And I'm just going to make a quick introduction. Jay has joined my firm just recently, but I've known Jay for 20 years. We used to work together at a long time ago at a firm. He's a master's in biotechnology, and he's been doing healthcare practice for a while. And his wife is also a dentist who's reopening at this time. So he's also in the midst of all this. The first half of the presentation will be done by Jay, and then I'll pick up in the middle to finish it. And just before we start, as a disclaimer, I'd like to just remind everyone that this is for educational purposes only. We are not dispensing legal advice, and if you do require legal assistance, we recommend that you contact an attorney. So with that, we're going to start. This is the overview of what we're going to do. We're going to talk about a little bit of the reopening plan from Maryland. Then we're going to get into some of the health and safety regulations that are applicable and some mitigating methods to manage your risk as you open. It would be the conclusion of this talk. Now I'm going to have Jay do the Maryland reopening plan and the liability portion of this.
Okay, thank you. Can you hear me, Reza? Fine?
Yes.
Okay, great.
You're coming into it.
Thanks to you for the introduction. It's a pleasure to be here today. As Reza mentioned, I am an attorney, but I do have a spouse who's a dentist. So we have been living this and going through this whole ordeal. I live in Virginia, and so she recently reopened about 2 weeks ago. The rules and regulations are slightly different, Virginia to Maryland, but nonetheless, we feel your pain and we know what you're going through. With that, let's begin. The Maryland Governor, Hogan, on May 6th gave his amended order. It was his amended stay-at-home order, and the link is provided in our slide here, where he said finally that licensed healthcare facilities and healthcare providers may resume elective and non-urgent medical procedures on May 7th, 2020. However, in order to do so, you must follow all the measures outlined in the governor's order and in the Maryland Department of Health's regulations. And again, we provided a link to the order there, and it outlines the steps you must take, and Reza will go into that in more detail. The requirements should be taken seriously, as they indicate that non-compliance is punishable by both fines and prosecution, but as we found out yesterday, that they're really not looking to enforce this part of it, at least with respect to healthcare entities, healthcare providers. I think in this regard, it's going to be more of a self-policing type of mechanism. That being said, take them very seriously, because this will be the new duty and standard of care that you guys will have to abide by. And also, as we indicated underneath, they've created a state portal in Maryland, which will allow patients and others, and perhaps even staff, to submit complaints if healthcare providers are not taking the appropriate measures. And that is kind of fraught with perils in and of itself. But basically, what does the Maryland Department of Health guidance for reopening say? They leave it basically up to the licensed healthcare providers and professionals to exercise their independent judgment in performing the medical procedures on patients and known COVID-19 infected patients. There is a PPE requirement that says they shall have at least 1 week's worth of PPE supply. If the facility or provider cannot provide PPE as required, it must revert back to urgent and non-elective status. They must also maintain all social distancing, and it must be strictly observed in all settings. That means in your waiting room, in your operatories, and what have you. You have to abide by social distancing to the best that you possibly can. And again, Reza will get back into that. And again, you've seen this throughout when you go to the store, go to the grocery store, there's marked off tape here and there. They want you to do that type of stuff in your office too. You know, don't have patients in the waiting room. Have them check in and check out if possible remotely. That's what my wife is doing with her dental practice. And again, screen patients before they come in. This is another big kicker here. It's the screening for the COVID-19. You must screen both patients and staff for COVID-19 at arrival for their shift or their visit. And Reza will get into that a little bit further. And again, you must follow the CDC guidelines. All staff must wear the face covering, their cloth or N95 mask, and patients wear a face covering whenever possible. Okay, slide. And you also must provide a certification prior to opening. Providers and facilities must self-certify that all reopening conditions set out by the Maryland Department of Health have been met. You must email these certifications to the email link set forth below. You must place a copy of the self-certification posted up where patients and staff can see it. In the waiting room would be a good idea. The governor also did give out another order, and this was a while back. It was order number 20-04-05-02. And this was somewhat of a conflicting order with the order he just gave out, because it delegated control and closure of unsafe health facilities to local officials. Basically what he said here was, although now with his new order, he's saying you can open, this order here that we're discussing delegated to the local health officials, such as in the safety officer in Montgomery County. Basically, he delegated to them to say, if that authorized health official determines that a business, organization, or establishment, facility, or site in his or her subdivision is an unsafe facility, and they're unwilling to cooperate, that they basically can close you down. Well, that does conflict with the order that they recently just gave out. And he can basically that individual can designate all or part of the unsafe facility as a zone in which they can control entrance or prohibit or limit movement of individuals to and from that. Again, we believe when we read this order and we read this delegation of order, that this order is not really meant to comply with, it's not really meant to limit the healthcare providers. All you guys should be following all the guidelines. It should be a safe environment. They would have to basically come to your establishment and find a violation, and then basically ask you to fix it. And if you didn't fix it, they could shut you down from that. But again, the orders that they came out, the governor's orders that came out the other day for reopening were basically related to non-healthcare activities, beaches, boating, camping, fishing, what have you, parks and all that. But again, the delegation of authority that they provided is basically meant to shut down these type of activities, and not really to hone in on healthcare providers and stuff like that. If they're gonna police this at all, even though we believe there's no real enforcement mechanism here, at least with regard to healthcare entities. But if they're going to police this, it's going to be if someone's having a big party at the beach, we think, or at a park, they will close it down. They're not going to come after you guys. As long as you guys are abiding by the rules, it shouldn't be a problem. Okay. That takes care of the governor's orders. And now we'll move on to physician liability and the standard of care. Well, as can be found in the Code of Maryland at section 3-2A-02C, that defines the standard of care. That's the care given by a healthcare provider in accordance with the standards of practice among members of the same healthcare profession with similar training and experience, situated in the same or similar communities at the time of the alleged act, giving rise to the cause of action. Basically, we're talking about here physician liability and whether or not you can get sued for breach of that duty. But in order to do so, there is a standard of care that's set out in the code and in the case law, and as I just read out there. And part of that standard of care is also going to be this new procedures you guys have to take and implement. That's going to be part of your standard of care. And prior to COVID-19, most physicians were already practicing or implementing a lot of these guidelines. And they were, so in other words, they were already meeting a lot of the standard of care for the prevention of infectious diseases. And some of the big ones here that are the differences will be, you know, obviously you got to wear the face mask and have the shields up and social distancing. But that's all going to be part of the new standard of care for you guys. There are new additional guidelines recommended by the CDC for helping to stop the spread of COVID. Again, I mentioned that, such as social distancing. And we put down here at the bottom of this slide a link that you can go to get your, that will help you get your clinic ready. So under these new, in this new environment with COVID, and there are clauses and laws in effect that help limit physician liability. And one of them can be found in the CARES Act. We all know about that. That was HR 748. Most of you guys should know that. And that helps to limit federal liability for Good Samaritan healthcare professionals during the COVID-19 emergency crisis. And it's basically, and it says that healthcare professionals who provide voluntary medical services related to the treatment or diagnosis of COVID should not be liable during this public health emergency. Exceptions apply for such things such as gross negligence, criminal misconduct, and providing care while intoxicated, what have you. The protections preempt inconsistent state and local laws unless state laws provide greater liability protections. That being said, the American Medical Association has made a call to the governors to protect against future liability claims for doctors following the COVID-19 guidelines and providing care under extreme pressure and overwhelming circumstances. And what do we mean by that? Well, they have a desire to basically limit their liability for harm resulting from act or omission related to following these federal and state guidelines during the health emergency. In other words, if there was a delay in care, delay in elective or non-emergent procedure, and that delay ultimately resulted in a harm to the patient, could that patient turn around and come back and go after the physician for that? And so they are seeking additional immunity here to be protect beyond the state of this current health emergency, to protect further out in that regard. And they also want to provide, civil immunity if they had to ration resources down here and they didn't use masks for everyone, or ventilators. If you had to make a decision, does this patient get versus that patient? Or you opted not to even give them a ventilator because they were healthy, but later on they developed something because that ventilator had to be rationed, or resources had to be rationed and given to a COVID patient. And those are all triaging scarce resources issues that come up here. So they are looking for further immunity and guidance in that regard. Okay, Reza, next slide. But Maryland does have pandemic immunity laws. It's a little bit different from Virginia, but Maryland has a public safety section in 14-3A-06 that basically says healthcare providers immune from civil or criminal liability if the provider acts in good faith and under a catastrophic health emergency. The Maryland Health General Section 18-907D also provides immunity from civil or criminal liability to healthcare providers who act in good faith in accordance with catastrophic health emergency disease surveillance and response program. But once again, these protections will not protect you from willful misconduct or gross negligence in that regard. Is there immunity for reporting elective non-urgent cases? The Maryland pandemic immunity laws do not extend to elective non-urgent procedures. Okay. And then it comes down to, can the physician be sued by a patient who contracts COVID-19 from a visit to a doctor's office? And the answer is, you know, more than likely it won't happen, but yes, it can happen if it's due to gross negligence or to negligence on the part of the provider. And again, it's all a matter now whether or not you implemented and maintained the proper standard of care. And that new proper standard of care involves the social distancing guidelines and the rules set forth in the CDC and OSHA guidance. This does all start changing the standard of care to a degree. There's an issue about would a liability waiver release form protect you? And in Maryland, injury liability waivers are generally enforceable with certain exceptions, such as ambiguous language, negligence, unequal bargaining power, public interest. You can't basically waive, you know, a waiver is not like a pass on negligence or something like that. At the end of the day, you have to follow the standard of care, obviously. It's advisable to obtain a liability waiver and or include such in your signed treatment informed consent form. This provides, again, as we said, Maryland generally enforces them. That's different from Virginia for any of you guys who cross the border. But these liabilities do provide some assumption of risk on the part of the patient. And if they're fully informed, informed consent by itself is insufficient to shield a medical provider from all liabilities, of course, but revise your informed consent forms to include COVID-19 and specifically mention that. And also, we recommend at this point that you contact your malpractice insurance carrier to inquire about their policies and ask them if they have an informed consent form related to COVID that they would like for you guys to use. That's always a good idea to work with them, because ultimately at the end of the day, if something were to happen and God forbid you were sued and you had to defend yourself here, they would be footing the bill. So it's always a good idea to reach out to them because they are useful in helping steer you guys and mitigate risk. Okay. All right. Reza, I believe that's you, right?
Yes, sir. Well, thank you, Jay. I'm going to take the lead now, and we're going to talk about a few health and safety regulations first. We're going to go through some OSHA guidance, and then some CDC regs, and just to get you familiarized with what kind of regulations would typically apply to your practice when you open. So the federal law basically entitles employees to a safe workplace. That's the main overarching issue that we have to be aware of. But however, OSHA has not adopted a standard for safeguarding employees at the workplace during COVID. They're relying on a lot, they're providing a lot of guidance. They're providing recommendations in conjunction with CDC, reopening and employer safety, environmental safety guidance. So you should constantly be following these rules and regulations as they change and they're fluid. As Ms. Dadio mentioned, that they're changing their website over 100 times due to these changes in the law. So OSHA pandemic recommendations are basically divided in 6 sections. And we're going to discuss each one very briefly, and I'm going to go through these slides pretty quickly. We've provided the PDF version of these slides to Ms. Stadio, and you know, please ask her, and she can provide those slides to you if you want, so you don't have to be taking notes as I go fast through these slides. So first and foremost, OSHA requires or recommends that you implement a risk assessment, identify which occupational exposure risk you fall under. CDC provides a pyramid that you can use to see whether you're low risk or you're high risk or very high risk, and based on that, you can again follow the CDC guidelines to implement policies and customize the policies to your environment to become follow the guidance with the OSHA and CDC. Even if you're low risk, it's advisable that you customize your work environment and your policies to protect your employees within that low risk environment. You know, obviously you have to follow all the guidance that comes out of federal, state, and local government continuously, and that's part of mitigating your risks for liability. OSHA also recommends that you should try to prevent, you know, environments where there's high probability of contracting COVID-19. So require your employees to wash their hands, use tissues, cover their mouth when they cough, stay home when they're sick, or go home immediately when they feel symptoms of COVID. You clean your office regularly. You've got to enforce very good housekeeping practices. So you got to restrict travel if you're traveling for any reason to certain locations that are, let's say, level 3 CDC COVID locations. Follow the social distancing and other recommendations, and also if you can and have flexibility to send workers home and to work from home, obviously implement that work from home policies and provide flexible hours. These are all ways to prevent and create a safer environment as recommended by OSHA. Once you have a safe environment, then you have to be vigilant in monitoring, identifying, and isolating employees who may be sick with COVID. So you've got to monitor your employees and ask them to monitor themselves for symptoms of COVID-19 in case of an exposure. So let's say they come across someone you think may have some symptoms, and the employees should follow, have a self-monitoring process where they, you know, make sure that they pay attention to their symptoms as they develop. You have to also, when something happens or when there are symptoms or you think there's an exposure and you think you have to address it, you have the employees have to report that information. They have to report if they come in contact with anyone. In this whole process, you have to also maintain confidentiality of those employees who come in contact with, and you have to isolate them for any reason. And I know it's very difficult. It's a balancing act. You have to maintain confidentiality as much as you can, but you also are responsible for the safety of the office, because you will have to identify which exposure, who has been exposed, and then identify, like contact tracing, anyone who has been in contact with that employee, and then possibly isolating those persons separately or sending them home, and again, balancing confidentiality information. So again, the Maryland order from the governor requires that everybody use everybody has to use masks. They have to be either cloth or respirators or N95 masks. So it's important to know that OSHA regulates the respirator portion of this requirement. The OSHA doesn't regulate cloth masks. So there are two ways that this can happen. That it can be voluntary, that the employees voluntarily want to wear them, or employer requires employees to wear them. In this scenario, all employees must wear them, so it's a requirement, and it's an administrative control over the environment of the employee. So that means that you must have a respiratory protection program in place to educate your employees the procedures of how to select these respirators, how to take care of them, how to fit test them, how to prepare them, how to clean them, how to disinfect them, and so on and so forth. And it has to be a written policy for you to be compliant with the OSHA regulation. If this mandate is taken off and employees voluntarily would like to wear these N95 masks, who are governed by the OSHA regulation, then the only thing that you would have to do, instead of having a respiratory protection program in place, you just have to give them the Appendix D of OSHA's respiratory protection standards so that they're informed about how to use this. But in this case, we're on the mandatory side, so you have to have the written respiratory program policy. Now, if you are in a low-risk group and you don't have to opt for an N95 mask, you're not in that environment, or certain part of your administrative portion of your team is isolated and they can wear the non-PPE or respirator mask, the cloth mask, it's important that you don't confuse that or enforce that as though they are wearing a PPE kind of a respirator kind of a face mask, because then if you treat a cloth mask like a N95 mask, then you're required to provide the same type of guidance as OSHA requires. But if you treat it properly, you require your employees to wear cloth masks, and you also in this situation have to provide some guidance in terms of how to put them on, how to take them off, not to touch the way that they manage getting rid of the mask. They shouldn't really touch their face during the day, and sort of a little bit of a training and education so employees know exactly how to use these cloth masks. It's not the same as we discussed with the respiratory protection program that you're required to have under OSHA, but it still has requires you to provide some sort of a guidance. And you also have to also suggest that the PPEs are not are to be in conjunction with other guidelines such as social distancing and washing your hands and again cleaning the surfaces. All of it has to come together. It's not just one. And once you put the mask on, then you're good. Then in terms of controlling your work environment, it is important that again you stay up to date with the policies of your local and state and federal government guidance, and communicate those updates with your employees. It's also important to remember that all the existing compliance with OSHA still remains. So the policies on bloodborne pathogens and required PPE and record-keeping requirements on OSHA 300 log still remains, and you have to follow those today. OSHA also has additional posters that are related to employee education for COVID that you can also post in terms of providing education to employees. One addition to these requirements and compliance is that COVID-19 exposures are recordable events. OSHA has exempted some employers from doing this because it's very difficult to determine how employees got this. Was it from work, or was it from an exposure from some other event that they had? Let's say they had party the night before and they got contracted the COVID virus. But regardless, OSHA has required that the healthcare providers, they all must record this event. If somebody is ill and or they think that somebody is ill, employee is ill at their facility, they have to make a determination that confirm that the case is COVID. They have to identify whether it's work related, and that portion is very difficult to determine, and also follow the recording criteria that's set out. Set out in the statute. Okay, so it's a recordable event, and don't miss it. And obviously, there's no retaliation if employees complain about work safety, environment safety issues. You can't retaliate against them. Both the Department of Labor and OSHA have weighed on this, and they're very serious about complaints in this fashion. Okay, so those are OSHA guidelines. We've put together some questions that have come up or come up during the opening process that has to do with the safety of employees at workplace. So we're going to go through them so just in case we can answer some of your questions. So first, question number one is, what if employees are hesitant to come to work during COVID-19? As long as employees' concerns for safety are reasonable and raised in good faith, obviously, the OSHA protects employees from retaliation action. Now, you have to determine as an employer whether the circumstances, the concerns are reasonable. Consider the circumstances, and for example, one concern that may be, one example of a concern that may be reasonable is when someone's traveling to a level 3 CDC marked location and they don't want to go, and that's a valid concern. But if you're following all the guidelines, the person doesn't have any comorbidities, and they're not, highly susceptible to catching COVID, and you're compliant, then the concerns may not be categorized as valid. Now, you have to remember that the definition of disability during the COVID time has kind of shifted a little bit. Now, some anxiety disorders may be considered disability during this time. So you got to consider your employees' concerns and determine whether they have to be accommodated with reasonable accommodation under the ADA and EEOC laws before you take any action. Okay, so then we have what questions should employers ask employees suspected of being sick with COVID-19 or other type of flu? So as you know, generally ADA prohibits employers from asking certain type of medical questions, but in this case, EEOC has allowed employers to ask employees about whether they're experiencing any of the symptoms related to COVID, like high fever, sore throat, loss of taste, gastrointestinal issues, nausea, shortness of breath, cough, or chill. They can ask whether the employee has been tested. Has the employee come in contact with a person who had been tested positive? Has a doctor recommended that they quarantine themselves for 14 days? Have they recently traveled to a level 3 travel health place under the CDC guidance? And also, do they require any accommodations because they are at a higher risk? And the order in Maryland order specifically requires that you have to identify your high risk employees and make accommodations for them. What steps should employers take before bringing a previously infected employee back to work? So obviously you have to be careful. You gotta document that there's a doctor note clearing this person to come back to work. You can ask them to submit to medical examination. Again, if you really want someone else to take a look at them, you can remain. You can require that they remain symptom-free for a specific period of time, and this 14 days of isolation may change, because now they're saying that you may be shedding virus after 14 days, or incubation period may come down. So you can just follow the recommended timeline by the authority. Can employers prevent employees from coming to work during COVID-19? So if you want to, there's an issue and you want to stop people from coming to work, yes, you can, unless you have policies that are against it. You have some agreements with certain employees that prevent you from not paying them or not asking them to come to work, or you have collective bargaining agreements. If employees, you can have your employees work from remotely with an altered schedule, obviously to reduce infection. And you also, again, if you ask your employees to work from a distant location, you have to determine whether you have to provide reasonable accommodations under the ADA rules. Okay. May an employer administer a COVID test, which is a test to detect the presence of COVID-19 virus before permitting employees to enter the workplace? So the answer is yes. However, the test has to be accurate and reliable, and there's a list of tests that are considered not to be accurate and reliable, and there's a lot of tests out there in the market that are not FDA approved, and the accuracy and reliability of those tests are questionable. So be careful what kind of test that you use. And then also remember that a negative test doesn't mean that you should throw away all the other workplace safety practices. You still have to have your mask, you still have to have social distancing, and cleaning and all that stuff has to go hand in hand. Very briefly, I'm going to go through just the topics of the CDC guidance. So just we've talked about it. So you want to prepare the way that you have to prepare your clinic. It's making sure that you prepare your office before the patients come, screen your patients when they arrive, inform them at the discharge about how to deal with infection, just in case they need to know, and they're educated, and train and prepare your staff to do this. And then obviously we discussed this, CDC guidelines allow you to rank or figure out which risk exposure level you fall in within the pyramid. And also you should follow, the guidelines that we have set here for if you have a patient with a suspected or confirmed COVID-19 issue. CDC guidelines also provide some guidance on implementing engineering and administrative control to reduce the chance of infection or contraction of COVID-19. You should, obviously clean your work from a clean area to the dirty area, limit contamination, and learn how to properly use the PPE at your office. Okay, so that was just a quick review of that. Risk management considerations are basically a few nuggets of information to give you some sort of a idea of how to mitigate your liability and risk, and some of these are recommended by malpractice insurance companies. So you follow these things, you kind of can reduce your or mitigate your level of liability and exposure to liability. And again, these are repetitive, and I'm sorry, these are all, they go back to, if you follow the OSHA guidance and CDC guidance, and all of these kind of reflect back to the things that you should follow in your office. So you got to monitor everything that's going on with the guidance that comes out of a local and federal and state level for dealing with this problem. You got to follow CDC patient assessment protocols to detect patients presenting at your practice. So making sure that the patients who are coming in, you evaluate them. And do not refuse patients who just merely come by and say, hey, I have acute respiratory symptom. Some of these patients may have, may not have COVID and may require for you to see them. So you don't want to, because you're still bound by the Board of Medicine and standard of care requirements, you don't want to abandon these patients just because they had some respiratory symptoms. Triage them on the phone, see if you have to see them, if their problem is something that can wait, or they have to come in, and make that determination before you summarily discharge them or tell them not to come in. As much as possible, use non-face-to-face modalities to screen your patients before they come in. At the front door, as the patient walks in, put some signage up that if they have symptoms and they're at the office before they come in, they call you and let you know about it. Have some instructions on how to about your practice and how they can deal with this while they get their medical needs met, and also remind them of social distancing. So when they come in, have a mask if they have symptoms, social distancing, cough in their elbow, and all that information. And if your office is closed, make sure patients know the office is closed and how they can reach you, because again, patient abandonment, we don't want to we don't want to make you liable for abandoning the patient. So leave them a voicemail, tell them that you're accessible on telemedicine and how they can reach you. Require the patients again to follow social distancing. In the waiting area, you sit 6 feet apart. Take all the toys and magazines out so people don't reuse them. Disinfect the area regularly. Evaluate your patients on a case-by-case basis. Make sure you ask them about the travel, susceptibility, symptoms, and whether the patient needs to be seen. If the patient doesn't need to be seen, then and they have some symptoms, you may want to postpone and have them self-isolate. Inside the facility, you should ask your patients to put on masks. I know the order says as needed for the patient portion of wearing masks. Utilize tissues on patient beds. Make sure that you clean the contaminated areas. Keep good hygiene. You got to display the posters for patients and management guidance. So you're not liable for not doing that. There are some posters that are required by OSHA, and then you have to also, the certification under the new order has to be viewable by patients. This is the Maryland's governor certification. Anytime that you suspect a patient has symptoms, make sure that use PPE. If there's a shortage, obviously you can see what the CDC guidelines are. And then for testing, you got to determine which patients require the testing. So based on presenting symptoms. And immediately you have to report these to the local health official. It is a good idea to maintain a record of staff on the log in a way that staff interacts with your patients. So if there is, if either your staff or the patient shows symptoms in a few days later or on that day, you know exactly who interacted with them, and you can do contact tracing and isolation easier that way. After the patients leave, before you take the PPE equipment off, clean the disinfect the place. Make sure that you have designated locations for getting rid of the PPE or used PPE, the contaminated PPE. Provide your patients with factual information about how to deal with isolation in home, how the infection transmits, hand hygiene, cough etiquette. Give some informational data to your patients, and screen your healthcare personnel on a daily basis, and make sure that you monitor and clean surfaces, and just follow the hygiene recommendations of CDC and OSHA. So finally, and this is the last slide, if you're in doubt, always opt for a clinical suspicion of COVID. The last thing you want is to send home a patient who may be sick with COVID, and then you get a group of family members sick at home, and that can cause maybe a professional risk for litigation if that happens. So that's it, and I'm going to hand this over to Ms. Daddio and go to Maureen's presentation, I guess.
Thank you so much, Dr. Ghafoorian. I know that's a lot of information to squeeze into just a few minutes. I'm sure you could probably do a half-day workshop on this topic. We would ask that you and Jay continue to look at the questions that are being asked via chat and try to address some of those as well during the next presentation. So we do welcome Maureen McCarthy with KatzAbosch to address the operational aspects. Before we go to her, I just want to mention that many of these questions are addressed in our Readiness Toolkit, which is on montgomerymedicine.org. Also, you have additional opportunities to ask these questions on those Dr. Haft calls, which are Monday and Wednesday at 5 p.m. and noon on Fridays. So we would encourage you to do that as well. So Maureen, we welcome you to present Navigating the Path to Reopening Your Medical Practice. Thank you very much.
Thank you. Thank you. That was a lot of information, Dr. Reza and Jay. So thank you very much. I'm going to try to get through my presentation in about 25 minutes so that we can leave plenty of time for questions for all of us. I know that Susan introduced me in the beginning, but I just wanted to, for those of you who don't know me, I just wanted to add that I have pretty much been in practice management my entire career. I actually worked my way through college doing medical billing. So I've been, operationally, I've been at this a very long time. So I will tell you, this is something like none of us have ever seen before. So we have to really be creative when we're talking about reopening the offices. I'm going to approach this from an operational standpoint, talk about planning, operations, and implementation. Next slide, Kelly. This is our overview for today. These are our intentions for the next 25 minutes. We're going to talk about the conversion from going from telemedicine back to on-site, and probably a hybrid of the two during the early phases. We're going to talk a little bit about safety precautions, but I really think that Dr. Reza covered a lot of that, so I will probably breeze through that a little bit. We're going to talk about patient and staff flow. We need to be cognizant of protecting our patients as well as the staff that work in the offices. We're going to talk about office configuration, or probably better said, reconfiguration. And then at the end, we're going to talk about working down the pent-up demand for patients who have not been into the office for follow-ups and those types of visits due to the COVID restrictions. So next slide. So first step, we are working with practices and recommending to practices who have been in touch with us to start the reopening process by forming a committee. And I'm sure that many of you have already done a lot of the things we're going to talk about today already. But just to give you our recommendations on how you might approach this, forming a committee with all the different areas of the practice representatives. So include the doctor, include the RN, include some medical assistants, of course, the office manager, practice administrator, and even members of the admin team. The front desk staff are going to have to be involved in a lot of this. The call center is going to have to be involved in a lot of this. So we are breaking this down into 4 phases. And 4 is really just kind of going back to phase 1 again. So phase 1 is where you are really going to open your on-site services to about a 25 to 50% normal capacity, and starting there and really trying to bring in patients that need to be seen face to face. Our suggestion is, until we hear what Governor Hogan has to say this afternoon about reopening all businesses, is to kind of start small and go from the 25% range up to the 50. Phase 2 is really moving to more on-site visits than not. So the 50 to 75% ratio, where you'll need additional resources. You'll still have to have all the social distancing and pre-measures in place, but allowing more patients to be seen, both for follow-up, sick visits, and well visits. Phase 3 is where you're really going back to full operations. And phase 4, and listening to the news, I think we might actually have to do this, is going back to a more telemed platform, and if we have a resurgence of COVID in the fall, winter. So next slide. You are going to have to follow all of these regulations, federal, state, county to county, and remember that the information, the advice that you get today could be different tomorrow. What we are seeing in the healthcare world is that things are changing day by day. In some cases, they're changing minute by minute. So, really kind of having the sites that you want to focus on and really checking those, or having someone in the office check those every day. Maryland Strong, Opening Up America Again, and each county will probably have their own. So, having someone to keep on top of that. I know the governor is speaking at 5 o'clock, and we probably all need to get a summary of that to get the newest information. Okay, next slide. So, talking about the path from telemedicine to office visits and how that is affected in each phase, because what you're really going to have to do is match your resources to the anticipated volume. So the resources that you're going to need in phase 1 are going to be different for phase 2 and 3. So mapping out with your committee all of the different phases and what you're going to need for that. Are you going to need, you're going to need more staff, you're going to need more PPE, you're going to need to probably change things as far as how you start out to being able to see more patients. Most importantly, you're going to have to think about your sanitation, sterilization process in the schedule. Many offices who have been seeing patients do a full cleaning in the morning, see a certain type of patient in the morning, whether that be your well patients or your sick patients, close the office for lunch, do a full cleaning again, and then also a cleaning at the end of the day. If you have cleaning people coming in, having them focus on areas that are most important, and then looking at first thing in the morning to make sure that everything is ready for patients to come in. One of the things that patients are waiting for is how your office is going to reopen, when that's going to be, so you need to have a process of how you're going to inform them. Website, text messages, email blasts, and real portal messages, and really letting them know where they can go for the most up-to-date information of how your office is operating during the different phases. And I find it very important, and I've been getting these emails from my own private physicians. They're sharing information about what they're doing to keep me safe. And that is very important for me to decide whether I really do want to come into the office or whether I want to stick with telemed as long as I can. That's also very important for your employees to really, put out there what the practice is doing and what phase you're in, so they can feel comfortable coming in as well. Next slide. So let's talk about the patients and what we're going to do to ensure their safety when they actually start coming back into the office for face-to-face visits. So the reception area. The reception area needs to be bare bones. You need to first of all, you're not going to have patients sitting in there for any length of time. Some practices are actually having patients call when they arrive in the parking lot, and then they're calling them when it's time to come in. So you may not be using your reception area at all at first, and then maybe in phase 2 and 3 you'll start using it a little bit more. But really making sure that you have that process in place and your employees are really familiar with that. Limiting the people who come with for visits with the patient. Preferably if it's an adult patient, they come in by themselves. If they're too sick to come in by themselves, having someone escort them to the door and then having your staff take over from there. I know there's been a lot of complaints about pediatric patients only having one parent when both parents would like to be there. It's really crucial that you have the least amount of people in the office as possible. Removing all items from the waiting room that could carry COVID germs if they're touched, which includes, any kind of decor, magazines, anything that could carry the virus. Establishing one-way traffic through the office. You're going to have to think about what your office flow is and how you could possibly change that so that you can have a path through the office where the least people, are crossing each other's paths. If you have 2 exits or 2 entrances into the office, using one to enter and one to exit is a great way to do it. You need to have signs, you need to have arrows for patients to follow, as well as staff, so that everybody feels like they're interacting with the least amount of people as possible. Establishing your check-in and check-out. Never before have we been so in need of credit card on file, so that we can actually have virtual co-payment collection, virtual appointment making, all of those things. So, really making sure that there's the least amount of contact possible from person to person. For COVID screening, Dr. Reza really covered a lot of this, but you're going to have to think about how your office is going to do this and how, what resources you have to accomplish. Temperature checks at the door. Some practices are doing temperature checks in the parking lots to really see if patients, can be seen in the office. Pre-screening process and interviews by phone. A lot of the primary care practices that we work with have been doing screenings when the patient makes the appointment, screenings the afternoon before, screenings the morning of, really asking patients about how they're feeling, if anyone in the house has symptoms of COVID. Have they been in contact with someone who later on came down with COVID that they want to share with you? And really trying to establish how well the patients are and changing course if necessary if a patient starts to show symptoms that, that they weren't showing before. So each office has to really establish this for themselves with the resources they have and, making the decisions and then publishing those decisions to the patients as well as the staff. So next slide, which is blank. Uh-oh. So we're on slide 7. One of the things that you want to discuss in your committee is what the menu of services that you can provide, that you can offer and perform safely. So that may be that there's a discussion for primary care whether you want to start up with well visits or not. And a lot of that depends on the type of patients you're seeing. Some of the pediatricians are doing well visits for patients that are under a certain age. They're certainly doing the newborn visits and they're providing those in the safest way possible. The other thing that your committee will need to discuss and decide is who's permitted in your office. We just talked about family members, but what about vendors? What about visitors? The UPS guy comes in, the mail carrier brings the mail in. Who are you going to allow in your office at this time? And if you are not going to allow them in your office, how are you going to receive orders that you need, where they're going to put that stuff so that it can sit for a while if you want to wait to open the boxes and whatever. You need to decide on who's doing triage and really enhancing that function so that they can decide who you're going to be able to see in the office, who needs to be seen in the office versus who really can continue to get by with a telehealth visit or a phone call. Are you going to see same-day appointments? And when are you going to do that? Are you going to see well visits in the morning or non-sick visits, follow-up visits in the morning when the office is at its cleanest, and then see same days in the afternoon? Based on your specialty, you're going to need to decide, what schedule is going to keep everyone the safest. Are you going to offer extended office hours at this time? Some patients may choose to come in when there are no patients in the office and few staff. So kind of thinking through your patient population and when they would be most safely seen for themselves as well as the other patients and the staff. Obviously, in the beginning, you're going to have hybrid schedules so that you're going to continue to do telehealth along with your face-to-face visits. How does that work? How do you set up your schedule? Are you going to have vaccine hours and shot hours, and where are you going to do that? So, those are all very important things to talk about. This is the new normal, and we need to do lots of planning to be able to achieve this. And what you establish now will lead you into the next phases. And if we hit stage 4 and have to close down again, you'll have all of this mapped out for how you're going to do that in the future. So next slide. So we have had a lot of conversations with our clients, our practices about staff, their fears, their concerns, and how they're going to feel safe coming back to work. So part 1 of this slide, of this conversation is what kind of workflow are you going to put in place for your staff? Where are they going to work? Are they going to be able to work 6 feet apart? Are they going to wear a mask? Are they going to have access to common areas like kitchen, restrooms, patient areas? That all needs to be discussed, and then it needs to be communicated to the staff so that they can make the best decisions for themselves as they come back to work. As Dr. Reza talked about, you're going to need a policy of what you're going to do to screen your staff. Are you going to do pre-shift temperature checks? Are you going to be able to do COVID testing? Are you going to have quarantine requirements if a staff member tests positive or their family member tests positive? Are you going to be able to offer immunity testing later on? Would this be able to be done so that you would know which staff would be safer in the offices? Or are you going to contract with a vendor who's going to be able to do this later on as this becomes more accurate and available? Developing policies and communicating to staff. And also, very importantly, when are you going to update those? Are you going to have the process you put in place now for phase 1 and 2, and then maybe change it 3, but really communicate with your staff on a weekly basis at least to how if you're going to change any of these pre-screening that you're going to do for staff to come into work every day. Staggering staff schedules. I know that a lot of the staff, the practices are trying to do a hybrid schedule for staff. Do they need to be, which staff need to be in the office? Which staff can telework? Trying to limit the number of staff you have in the office at any one time is probably a really good idea. If you're going to see patients and need X number of staff, let's have that X number of staff. Now, I know that this presents a real problem when it comes to spending your PPP money. So you really have to think about this in 2 ways. Keeping staff safe, keeping the right amount of staff in the office for the patients that you're going to be seeing, and spending your PPP money. So that, obviously is a three-pronged conversation that is very important to have. One of the key areas for staffing is which of your employees tend to have health concerns that are more high risk, who is more vulnerable to the COVID virus, and how are you going to deal with them? Are you going to keep them working at home? Are you going to have an area for them to work in that's more closed off so that their exposure is a lot less? The other thing that I think is really important, I know that with the PPP money, you need to pay staff a certain amount so that you meet the criteria of the 75%. So if you say employees will not be in the office unless they're absolutely needed, and you're going to allow employees to telework, I think it's important to have daily check-ins with those employees and set deadlines for any projects that they might be working on, or deadlines for the tasks that you need done to be done by a certain time each day, so that you can check in on that. Because you really, you want to have employees able to work at home if that's feasible, but you also want to make sure that the work is actually getting done. And I know that's hard with family at home, kids at home, homeschooling, but I think it's important to send the message that you are monitoring that work. Okay, next slide. So masks, I know that Dr. Reza covered this a little bit, but I think that you need to have a policy of when an employee has to wear a mask, or do they have to wear one all the time, or where in the office do they have to wear one? If they're in an office with the door closed, do they have to wear a mask all day? So having those conversations, deciding what your policy is going to be. Are you going to provide masks, or are you going to have them bring their own mask? So I think that that's an important decision that you make, and then you have to communicate that to your staff, because they're going to have to buy a mask if they are going to wear cloth masks, or are you going to provide them? So giving them a little bit of time to plan for that. Training. We need to make sure that we're documenting all of our training and procedures for PPE, social distancing, and sanitation training. There's been all kinds of news reports about how to sanitize. Do you spray an area and do you wipe it down? Do you do that one way? Do you do it like you normally would clean a kitchen counter? Really making sure that your staff is up to date on, what makes sense when they're doing some of the sanitation work. One of the bigger concerns that I've heard is whether you allow your staff to wear their own street clothes, whether they should change when they get to the office, whether they should change before they leave the office to protect the family members at home when they travel home. So one of the ideas that we've talked about is providing uniforms temporarily, not forever, but really providing scrubs or uniforms for them to change into when they get to work, for them to change out of when they leave work, and how many days would they wear those, and are they going to be laundered, or new uniforms going to be provided? So I think that having that conversation and checking into the cost of that kind of a process might make employees feel a little bit safer. I am hearing a lot of practices tell me that their employees are not ready to come back to work. They don't feel comfortable coming back to work. And I think maybe offering them masks, offering them cloth scrubs to change into when they get to work, and leaving them there for laundering or sending out when they leave would probably make them feel a little bit better. It's a tough call right now whether staff is really worried or whether they are wanting to remain on unemployment. And that is something that you really have to sift through. If you offer a staff member full-time employment coming up here and they turn it down, they're not eligible to continue to collect unemployment. So again, longer conversation, but making them feel as safe as possible, I think, is something that we really need to focus on. Okay, next slide. So let's talk about temporary office reconfiguration. And I just dropped my slide, excuse me. So how do you set up your office in a way that it is the safest for your staff as well as your patients? So having hand washing stations and having those available for patients. This may not work in your office. You may have to have hand sanitizer, which might work better if you can get it. Having instructions, if you have hand washing stations, having instructions hung up for how to wash your hands, when you need to wash your hands, and other sanitation type type of advice. Disposal of tissues is also an important one to have. Having barriers between staff and patients. I know that offices have installed plexiglass for check-in and check-out so that they can protect their staff as well as the patients, even though they're wearing masks. But considering what your office configuration is and whether you have to go to this step to really make people feel more comfortable. We talked about this a little bit before, but really trying to remove all unnecessary objects. So toys, decor, magazines, pamphlets, anything that's in your reception area that could carry the COVID germs, and really getting that out of there and making sure that stays out of there. Having security for the PPE that you keep in your exam rooms is another important conversation to have. I have heard from practices that patients have stolen boxes of gloves, have stolen boxes of masks, and that needs to be secured. So making sure that you don't allow that to happen, because it's really hard to get, which is probably why they're walking away with it. We talked about this a little bit, but how are you going to set up your office to have the social distancing signs, arrows, stand here type, circles for people to not, kind of cluster together at checkout or whatever. I think one-way traffic is probably a really important part of this, if your office configuration will allow that. The other thing that you really need to talk about in committee is how you're going to restructure your scheduling templates. You've got telehealth, you've got phone calls, you've got patients coming into the office, you've got staffing concerns. So figuring out your scheduling templates to make sure that you can work all these things together to make sure that when your front desk people are scheduling appointments, that they can do this by, with ease, so that they know where everybody is. Talk about clinic days. So you are not going to be able to see the same volume of patients that you saw before. You are probably not going to want to see the same volume of patients, and hopefully you're not going to need to. So really talking about how are we going to schedule the sick follow-up visits, sick visits or follow-up and well visits, and how much time do we need to allow in between for cleaning, loading supplies, and kind of thinking about what's the time period. If you used to see 15-minute visits, you're probably not going to be able to see any closer than 20, 25-minute visits. So looking at your scheduling for for reconfiguring that template so that they can fill that in. All of this is going to cost additional time, and it's also going to cost additional money. So really, once you get all this mapped out of how you're going to reopen your office, how you're going to go from phase to phase, putting a budget together so that you can make sure that you know exactly how much it's going to cost you for, for all of these different stages of reopening that you're going to go to. Okay. We talked about this for a second, but I want to talk about the new norm and what services you can do now and can be done in the office safely. You may not open your schedule to do all types of services, but you will maybe you'll open your office for just visits at first, and add other services later on as you feel comfortable. vaccines and those kind of services are going to need to be fit into your schedule, but maybe you don't want to do that right now, and you only do it for patients that really need that to occur, babies, toddlers, you know, other different services. Are you going to do EKGs right now? Maybe you're not. Maybe you're only going to do those after you get to phase 2 or 3, or when you reopen your schedule to actually do well visits. So kind of talking that through and deciding what services you're going to offer in each reopening stage. I would also talk about, and this is an important one, both financially as well as for getting the patients back to a normal doctor office schedule. So consider whether you're going to do days of well visits and vaccines only. So you clean your office, you're only having well visits that day, you're only doing vaccines that day, and so, you know, you may have a different procedure for those days versus maybe another day you're going to do follow-up visits, and maybe you're going to schedule patients based on risk groups. Maybe your high-risk patients that really need a face-to-face visit, you're going to have those on days when the risk is lowest to them, and you schedule those farther apart. A lot of the practices are already thinking about how they're going to be able to catch up on the pent-up demand for the history and physicals that they're behind on. So some practices have talked about doing some extended hours. So they're going to do physicals from, you know, 4 to 7 a few days a week, so they can kind of work down the appointments that have been missed. And maybe having weekends. You know, your doctors have been doing telehealth visits from home. They probably would be more than willing to come in on a Saturday for 4 or 5 hours, you know, to get those physicals done, and maybe having vaccine shot clinics on those days. So this is going to be customized for each practice, but all of this really needs to be mapped out. Okay. So with telemedicine continuing, you still need to focus on informing your patients about the different ways they can communicate with their provider. They're probably pretty comfortable right now as to how they communicate with you if they need a telehealth visit. Do they call? Do they email? Do they go through the portal? You know, as we change and go through the different phases, making sure that they understand how they can contact their provider for whatever reason it is, whether to schedule an appointment or whether, you know, they have a question or a sick visit request. Making sure, and this goes back to what Susan said in the beginning, they have a grid on their website that shows you all the different payers and how they're processing telehealth visits, and making sure that you are keeping up with all the different codes, modifiers, billing updates, and then building that into your scheduling and building that into your practice management system, so that you make sure that you're accurately submitting claims and getting paid. Something that I don't know if people are keeping up with, but there are RPM codes, remote patient monitoring codes. You know, DC Medicare pays these codes at $60 to $75 a pop, and it really just means that you're able to monitor your chronically ill patients from home, and having that system in place in case you don't want to bring those patients into the office yet because they're just too high of a risk. So look into those codes, see if that can be built into your schedule, and that's a way for you to take care of patients and actually get paid a little bit more for that. Restructuring your templates and provider schedules as needed to reflect the appropriate phase. We're going to need to keep on top of that. And of course, remaining HIPAA compliant. I know that the HIPAA rules have been relaxed a little bit right now, but that's not going to last forever. So making sure that you're watching for deadlines so that you can flip the switch back to your old HIPAA compliant procedures as those things change. Okay, so last we have our summary slide. We've talked about today forming a planning committee and have all areas of the practice represented, mapping out your phases so that you can kind of decide what phase 1 is going to look like versus 2 and 3. And if you have to reclose in the fall, how are you going to do that? And how do you kind of work through the phases again and notify patients of what's going on? Practice resource planning. This is the key to all of this, and making sure that you have the right resources, the right staff, you know, how you're going to pay for that, what that's going to cost, really making sure that you have the appropriate schedule grid for each phase of the reopening. We talked about office reconfiguration. This isn't going to last forever, hopefully, but right now we're going to have a very different flow in our office, and that's going to work very differently than we're used to. Hybrid schedules, you've got telemed and face-to-face, and how you're going to do that, how it's going to change during the different phases, I think is an important part of that planning committee's tasks. Patient care considerations, you know, how do we make sure that the patients are on board with whatever the practice decides to do, and making sure that they're comfortable with all of that, and not forgetting the staff and the safety issues and the concerns that they also have during this really tough time. So that's the end of my presentation. I know that we have plenty of time for questions. We don't have plenty of time, but we are going to be on the call for as long as you need us to be to answer questions. Thanks very much, and I'll turn it back over to Susan.
Thank you so much, Maureen. Again, a very comprehensive presentation. We appreciate your participation. And we do know that, again, you could do a half day or full day on this topic and still have things change tomorrow. So what we're going to do now is I see that there have been additional questions that have been submitted. We also have had our speakers who have been weighing in on many of your questions during this period of time. So I think the best thing for me to do at this point is kind of start from the bottom and work our way up. And then certainly if I don't address a question that you had and it has not been addressed by a speaker, then what I would encourage you to do is unmute yourself and ask that question, because that's one of the limitations of Zoom. It doesn't tell you which of the questions have not been addressed yet. So one of the first questions is, are we cleared to start doing elective surgery, non-urgent care in Montgomery County? And candidly, I'll just address that. You have, in terms of the governor's order, it is up to your judgment in terms of whether or not you choose to start doing that. But the reality is that you have to consider your local area as well, and your own environment, as well as whether or not your practice might be in a hot spot in Montgomery County. So you have to, as the physician, make a judgment about all of those issues. Dr. Ghafoorian, do you have anything to add to that?
No, that's and also a week worth of PPEs that you have.
Yes, of course. So you have to meet the standards that were outlined in the governor's order, and you have to be willing to certify that you're meeting those standards. So we have a question: do we have to document daily screening of staff? Who would like to address that, please?
I can take a shot at it. I think because you're certifying with the governor that you are compliant, I would certainly recommend that you document your daily screenings with your employees.
All right, thank you. We have a question: are N95 masks required for patient care or just recommended?
Well, in terms of doing non-emergent and elective cases, you must require masks. Now, which masks you're going to use has to do with your level of risk, as you can assess it based on through the CDC guidance. So, and then also CDC has additional guidance on how to deal with the priorities that you use to identify where to use what kind of mask for which kind of patient, even when they're symptomatic. So there are many different layers. I have attached, somebody else asked this question too, and I think I attached 2 CDC guidance a little bit further up in the comment section that would address that, that whole scenario.
Thank you. So this question would be for Maureen. For claims that were submitted prior to the increased reimbursement by Medicare, how do we get the increased rate? Do we need to resubmit claims with an additional modifier, or will Medicare just send the additional amount?
I don't have the answer to that question exactly, but I certainly can research that and send it over to you, Susan, and you can send it out. I do know that a lot of practices got caught up in the codes changing so much, and the modifiers especially, and so they did have to resubmit those. But I think that if it's just a price increase, they're probably going to reprocess. But let me check into that a little bit more, and I'll send that to you.
Thank you. So we have a question about self-certification. How can we state, quote, social distancing strictly observed when we need to be closer than 6 feet for patient care? This is an ophthalmology office, so they do application of drops, checking pressure, slit lamp exam, all at arm's length.
I think the social distancing has to do with, when the patients are waiting to be seen, not when the patients have to be examined by the physician. Jay, did you have something to add?
Yes, that's correct. Looking back at the order, the social distancing requirements have to be maintained basically in settings where people must wait in order to minimize direct contact. When you're visiting, when you're in the room and being observed by the doctor, okay, it doesn't necessarily apply there, or procedures being done. But if you're in a waiting room or you're waiting for the doctor, then yes, it has to be strictly maintained then.
So we have a question, and possibly one of our panelists could address this. If we can't send sick patients home, where would we send them?
Again, CDC has a long-winded guidance on how to deal with patients who are sick and where to send them and what to do with them. I have attached the CDC guidance a little bit further up, specifically with respect to that question, and I can post it right now again for you to see.
So this question would probably go to you or Jay. Do all patients require COVID testing preoperatively? What type of mask / respirator is required in the operating room?
Once again, CDC has specific guidance on how to identify the patients that you need to wear masks with, and they prioritize in terms of availability of masks. Now, obviously, if you're doing elective procedures, you have to also follow the strict guidance from the governor. But if it's not an elective case, then you follow the guidance of CDC when you don't have the mask, or the masks are not available, or certain masks are not available. And again, there are 2 guidances that go to that, and I posted it up here to a similar question before.
So we did have a question, where do we submit the certification with governor, or is it self-posting in the office? It's actually both. And Jay did provide the email address that can be used to submit the physician certification. We have a question.
I also added.
Yes.
Oh, I'm sorry. I also added there's some posters, OSHA posters, that you also need to post, and I put the OSHA poster page, so you can just go down the line and see which ones that you don't have and add those.
This practice has a concern of airborne viral particles in HVAC systems. Can you please comment on practice safety concerns for HVAC systems, HEPA or MERV filters on air handling systems?
Yeah, I wouldn't know that off the top of my head. I have to take a look at it.
Well, and we've had some questions about practices that are in large office buildings, and that may be something that you want to talk to the building owner or who you lease the space from, because they may have some direction about that. So we have a question: what are the best screening questions to ask patients and employees before coming to the office? A lot has changed since March. Visiting level 3 countries, exposure to COVID, plus person and asking about cough, shortness of breath, and fever are no longer all inclusive.
Is this from patients? Yeah, again, CDC puts out, specifically the questions that, minimum questions that you should ask that has to do with the, as you said, the symptoms, the travel, and, whether they've been in contact or they've been recommended to stay quarantine. And those are basically the things that you can ask on the phone, short of having them come and take a test at your facility.
All right. Well, we want to thank all of our speakers today, Dr. Ghafoorian, Jay, and Maureen, for helping us. And we do have one more question. If a patient presents to the office, routine screening is done, and obvious signs of a fever, but they insist on being seen by the provider due to urgent nature. What's your thought about that?
I think there are procedures that you have to follow when the patient is sick or shows some symptoms, for example, and you have to see them. You got to make sure that they're isolated. They're put in a location that is, vented, if possibly vented, a location that is not close to everybody else. Maybe you take him from the back door to enter the office so it doesn't go through the waiting area. And you follow those procedures, and there's specific CDC procedures to follow when the patient is sick and you have to see them in your office to reduce the chances of exposures with other people. And then if you are coming in contact and your staff is coming in contact with this person, make sure that PPEs are properly used, and then clean the office after they leave, discard the PPEs in a specific containers, and then provide recommendations of how to self-quarantine or what to do depending on the CDC guidance when they leave your office. So from the beginning to the end, you got to follow through with the patient, and you can't abandon the patient if it's something that you need to see or address due to an urgent matter.
So there's a follow-up question. Does that mean the patient has the right to control what we do?
Well, no, it's in your discretion, because you talk to the patient and you figure out whether the patient has an urgent matter to see you, and you can triage the patient on the phone and determine whether that is an urgent matter for them to come in, and that's, you're kind of bound to that, the phone triage. I mean, if the patient is hysterical and they're in pain and they have a lot of issues and they want to be seen, and if it's an urgent matter, it may be prudent to ask them to go to the emergency room. I mean, if it's something that is very urgent, and then you can make a determination on the triage as to whether it's something that you have to see today or you can wait a little bit longer. But I think that the decision making is it's up to your medical expertise, as long as you follow the standard of care and you don't abandon the patient.
So again, we thank our speakers. We'll make sure that their contact information is in the follow-up email from this webinar, as well as the copies of their slide decks, so that you can refer to their resources. It also comes to mind that there has been great Q&A, and so we will pull the resources out of the chat box and make sure that we share those with you as well. And we remind you again about the Readiness Toolkit that we have available. And Carissa just posted the link. It answers many of these questions, or at least it provides the resource for you to look into based on your own practice needs and your patient needs. We want to remind you about the handcraft agreement that we have. We'll be rolling information out about that. It is for many types of PPE, but what has mostly been mentioned in this presentation has to do with gowns and masks, and also potentially with uniforms for your employees. We do thank you for joining us today. We thank you all for the work that you do each and every day, and especially during this COVID-19 crisis. We encourage you to look to the Medical Society to be your resource. We're here for you, and we're happy to do our best to answer the questions that you have following this webinar. So thank you very much for staying with us. We hope you have a wonderful day. Thank you.
Thank you.
Thank you.